Today, we're going to talk about the piriformis muscle. For most runners, the strengthening of the piriformis muscle is important for shifting body weight while running, and this keeps us from falling. The piriformis is a part of the abductor muscle group. It is found within the pelvis against its posterior wall and partly on the backside of the hip joint. It takes origin from the front of the sacrum or the tailbone.
It is a pear-shaped muscle in the gluteal region or buttocks. This muscle helps move the leg away from the body at the hip or abducts the hip. It also internally rotates the hip when hip is flexed at 90 degrees or more.
This video mainly talks about exercises and a condition called piriformis syndrome for runners. Piriformis syndrome is a neuromuscular disorder and could occur when the sciatic nerve is compressed by an inflamed piriformis muscle. It causes pain, tingling, and numbness in the buttocks all the way to the lower thigh and leg.
The following are some stretches that can be done to relieve piriformis syndrome. This one is called a supine piriformis stretch with a crossover. The next stretch is a supine piriformis stretch assisted by an opposite leg crossover.
Here are some exercises to strengthen piriformis. The first one is monster walk.
For this exercise, make sure that the band is above knee level so it does not put strain on your knee. Bend the torso a little bit and make sure that the band does not move below the knees.
Standing squat.
Have your feet about hip width apart and sit into the squat such that the knees do not pass the toes. Once you're comfortable, you can sink even deeper into the squat, and this allows for more range of motion.
Gluteal bridges.
A 90-degree angle is formed at the knees where the legs are bent and the hips are gently lifted off the mat while the glutes are squeezing on the up face.
Clamshell leg lift.
Once again, the band is placed above the knees, and during this exercise, the legs are externally rotated such that at the end point the knees are facing the ceiling.
Side leg lift.
In this exercise, the feet are kept flexed, and the leg that is being raised on the down face is allowed to touch the other foot but not rest. This ensures constant tension within the muscle that's being worked.
Front and diagonal lunges.
The feet are kept about hip width apart, the torso is upright, and make sure while bending down that the knees do not pass the toes. Always maintain a stable core. In the diagonal lunges, it is almost the same thing except a step is taken diagonally forward. The hind leg is always kept straight and does not turn to the side of the front leg.
Now we are going to talk about the mechanism of injury. Dynamic overload or training errors can occur when there's lots of running or change in direction. These are some factors that can injure your piriformis. Hard surface, such as concrete, exercise on uneven ground, starting exercise after long layoff period, increase exercise intensity or duration too quickly, worn out shoes, and sitting for a long time.
The line of treatment for piriformis syndrome. If the client coming to you within 48 to 72 hours of injury, the line of treatment would be rest, ice, compression and elevation. If the client coming to you after 72 hours of injury, will start with the heat to relax the muscle, reduce the tension or spasm in the muscle and encourage blood flow. Then we can start with the stretching exercise for the piriformis and other external rotators of the hip to release the tension and pressure on the sciatic nerve. Deep massage can be done to enhance healing by increasing blood flow and decrease muscle spasm. When pain allows, Exercise to strengthen the piriformis muscle can be done, which should help prevent the injury reoccurrence.